Kristen from the Goddard School. Yes, representing Goddard. Love it. All right, guys, I have right at 1 o'clock. So we're going to go ahead and get started. I'm minimizing the videos, and on your controls, you can do the same. It's up to you guys. But we want to use every moment of this time because we know realistically we probably need more than the 60 minutes that we scheduled. But I know you guys need to get back to work, those who are working, and there are a lot of meetings and trainings going on now. So we want to honor your time. So Elaine, welcome Elaine and LaFerris. All right, so today we want to make sure we're actually talking to practitioners about what the needs are and how they're handling the COVID-19 pandemic. I've been on a lot of different calls, meetings, webinars over the last 6 weeks or nearly 2 months now. And, you know, we're trying to figure out how we can support, you know, how do people open? If you are open, how are you handling it? And so we decided we're going to ask the practitioners directly. So we are so thankful to have two 3-star quality rated providers with us today. So we have Wande Okunoren-Meadows from Little Ones Learning Center. We also have Myra Abdus-Saboor from Teach the Children Early Learning Center. It's the name of her program, but she is a family childcare provider. She has children in her home. And we are thankful that they're able to join us. So welcome Wande and Myra. You guys say good morning to the people.
Good morning. Oh, good afternoon.
Good afternoon at this point, yes, right.
Good morning, good morning.
All right, so again, whether your program is open or not, we figure this is an essential conversation. It is not our job to tell you to open or not to open. We just wanted to provide you information so that whether you decide to open or not, you have some information on how you can handle the health and safety in your program. So whether you're a family childcare provider, group provider, center-based, we figured this would be a great way to engage in conversation and find out you know, what are some specifics that can support you in your decision and your daily practices. So BCDI, Black Child Development Institute in Atlanta, we are an affiliate of the National Black Child Development Institute in DC. And so we were established in 1981. NBCDI was established in 1970. So this year is the 50th anniversary of NBCDI, and we're in our 39th year here in Atlanta. And so what we do is represent programs in 6 focus areas. We provide programs and community initiatives throughout the state, even though we have Atlanta in our name. We have 6 focus areas, and you see them at the top right of the screen: early care and education, which is why we're doing this today, part of our initiative; family engagement, literacy, health and wellness, public policy, and child welfare. Our mission is to improve and advance the quality of life for Black children and families in Georgia through education and advocacy. And if you work with Black families, work with Black children, no matter whether you are African American or not, it's important to learn how to effectively work with Black families and children based on how those needs are best met. Our website is BCDI-Atlanta.org. So welcome to everyone who joined us today. I'm moderating the conversation today. I'm Dr. Bisa Lewis. Everybody calls me Dr. Bisa. I'm president of BCDI-Atlanta, the proud president. We have an amazing affiliate. So our agenda, we'll do just some quick housekeeping, and then I'll introduce our speakers to you officially. We'll talk about who's open, and I'll be asking you guys to share by raising your hand, whether you're open or not, and why. Also, we'll talk about policies and myths, daily routines, stakeholder engagement, challenges and needs. So we want to see what the needs are. Again, we've been trying to discover those in different meetings I've been in, but we want to hear from the providers themselves. And then we'll have some Q&A in closing. So we'll be using this entire 60 minutes. It's quick housekeeping. Many people have been using Zoom or some online platform lately, but I like to go over this just in case you're not sure how it works. So everyone is muted upon login. We have 73 participants on right now. Again, we had 167 registered this morning. And as you know, we as educators, we can talk, right? But everyone is muted so that we can use our time wisely and not have any interferences. However, you will be engaged because there's a raise hand feature If you're on your computer and you look on the toolbar, there's a raise hand feature. If you don't see it, you can click on the 3 dots where it says more under it, and you may have the raise hand feature there. So you can use that when certain questions are asked and you want to respond. If you're on your phone, the raise hand feature is going to be *9. So you would press *9 if you're calling in from your phone. We'll be utilizing the chat feature primarily, especially for questions and comments as we go along. Again, that will enable us to keep rolling. And if you don't see the chat feature, again, you click on those 3 dots on the toolbar where it says more, and you will see the chat feature there. And it should be showing orange right now on your end because you already have comments in the chat. So we'll also be, if you are asked a question or to respond, if there's time at the end, you can press *6 on your phone to unmute. And you can hover over your picture if you're calling in, if you're on the computer, and to unmute. But we want everyone to stay muted right now because we want to honor our time. So thank you guys again for joining us today. So meeting norms, and I'd like to go over this again. We have 77 people on right now, so we're going to be respectful. Our goal is not to judge anyone for the decisions that they're making, but we just want to find out information today. So we're going to stay muted unless we're otherwise instructed, answer questions, make comments in our chat. We're going to stay on topic because as educators, guys, there's so much we want to know right now, and we want to use this time to find that out. And another thing, we've been in the house, a lot of us, and we just want to talk to people. So we're going to try to stay on topic, and then we want to respect all the questions and responses because we know there are a variety of views that are out there right now about whether people should open or not. Okay, so we have the wonderful Myra Abdus-Saboor with us. She is a family care provider. Her program is Teach the Children Early Learning Center. She's a family care provider in home. We love her. She is a 3-star quality rated program. So welcome, Myra, and thank you for agreeing to present for us today.
Thank you, Bisa, and I'm happy to be here. Happy to be here.
Yes. And we also have Wande Okunoren-Meadows is also a 3-star rated center. She's also, their program is nationally accredited by NEYC. They're part of the Georgia Organics program, and it's Little Ones Childcare Learning Center is her program, and she is executive director. So, afternoon, Wande.
Hello. Good afternoon. I can't see myself. I don't know if you can see me though.
Oh, yeah, I minimized mine just to see the slides. So disclaimer, we want you guys to know that none of us are here today as experts. The opinions and views that we're presenting are based on the information that we have received on the different meetings, calls, webinars we've been on lately, based on the information that has been dispersed. And so we want you to remember this is a conversation. Today is not really, we didn't want to call it a webinar, but it is more of a conversation about what's going on in the programs and how they're handling it, so we can support anyone who is trying to figure out whether they want to open or whether they're already open. It is not our place to say whether you should open or not. So we do want to know who's open. So if your program is open, please use the raise hand feature and you can see it on your toolbar, or you can also click on the 3 buttons that say more. Oh, good, I see people raising their hand, great. So raise your hand. If you're calling in from your phone, it's *9 to raise your hand. We want to just get an idea of who is open. So if you go to qualityrated.org, you can see who's currently open right now. These are the programs that have reported to DECAL that they are open. And this information was pulled specifically on yesterday. So you can see, and families can also go there to find out where childcare is available in their area. If you're not open and you decide to open, make sure you let DECAL know so you can be added to the list. You can also go to All Georgia Kids, All GA Kids, and through QCC, and let everyone know that you're open. And one of the QCC folks, if you guys want to throw that specific web address in the chat, that would be great. So they can find the All Georgia Kids as well. So we do know 2 programs are open, and we have, again, Wande on, we have Myra on, and 2 questions we want them to answer. 1, why did you decide to stay open? And then 2, what's the feedback from families? So take us back to the day you made the big decision mid-March on whether you should stay open or not, why you decided to do so, and what has been the feedback from families. So Wande, Myra, either one of you can start.
I'll start. I took a poll from my parents to find out what their needs were and if they were still working, because most of my parents are essential workers. So out of that poll, I think like half, a little bit more than half, because I only had 2 parents not attend. So actually I have 5 the rest of my families are attending. So, and then they work. They're essential workers. And so that's what encouraged me to make my decision, as well as this being my business, and this is, my income. So.
Thanks, Myra. And Myra, how many children do you currently have in your program?
I currently have 6.
Okay.
I have 6.
Family childcare can have up to 6 in their home, and so she's maxed out right now. Thank you, Myra. What about you, Wande?
Actually, Bisa, we can have up to 8 because you can have 2 after schoolers.
Okay.
So, yes.
Great. Thanks, Myra. Wande?
Okay.
So I just took an assessment of what was going on in my community. At the time, we didn't know anything about what was going on. Just talking to some experts around the country and in the community. We did, at the time, Clayton didn't have any outbreaks, no documented cases. So we just really looked at what was happening in the community and decided to literally just take it day by day, and we would make assessments from there. The feedback has been nothing but support. We did limit it immediately to only essential families. So it wasn't going to be care that was provided to, normally on any given day, we have 175 kids running up and down our halls. So once we limited it to essential families, it went down to like 20, 30 kids. So those were our primary families that we were serving.
Thank you, Wande. So on an average day, you have about how many children again?
Yeah, so we have 175 enrolled. So on an average day, maybe about 160 might show up. Mm-hmm. If everybody shows up, maybe 175.
Okay. Wow, thanks. So anyone else who's open, if you put in the chat as well why you decided to stay open, and then what's the feedback from your families. If you just reopened, you can also share why you decided to do so and what's been the feedback from your families. All right. So policies and myths, there are a lot of discussions out there about what you are supposed to do or not supposed to do or required to do by DECAL or CDC. A lot of myths are floating around. We want to make sure we are distinguishing those policies correctly. And I do have information that you guys here, if you want to take a picture of this slide, if you want to download the information from DECAL, they're constantly updating this particular page. Also, if you want to, the third item down, the childcare operation checklist that came out recently, you want to make sure you download that because that is the guidance that DECAL is referring to. Also at CDC, we have resources from there if you want to check this page on a regular basis. As of yesterday, it had been updated on April 21st. So your guidance may be coming from one of those 2 places. So want to give you those resources. But we want to hear from Wande and from Myra on how are you guys handling social distancing? How are you handling group size based on the recommendations and requirements that came out from DECAL and CDC? So Wande, you want to start this one?
Yeah, so our group sizes we haven't had an issue with that. We have many different classrooms. We have 1 teacher at least in every classroom. We don't ever plan, if it gets to the point where we have to have 2 teachers in a classroom because of ratios, that's just not something that we're going to do. We want to make sure that we're doing our part as an employer and make sure that we're not putting our staff in a situation where there's going to be 2 people that may not be able to adequately maintain that social distancing. We've also purchased these things throughout our outside in our parking lot, because that's where we do some of our maintenance stuff outside. So we had to purchase some signs. And we also have, I don't know if you're gonna get this, but the masks and all that good stuff. So we've rearranged our break schedules so that we are not able to, we shifted the way that we do breaks. So it used to be that, the educators would work, 4 hours, have a break, and then come back. We believe in trying to do our best to maintain as little interference coming into this program as possible, which means instead of having another, because we had we had teachers that were working split shifts. So now we don't do that anymore. We have them working straight through the day. They can bring their lunch, eat here on the clock. Sometimes we purchase lunch for the staff so that we're not having different people coming in and out of the classrooms, out of the programs. We want to keep one teacher in with that same group of children and not having multiple teachers coming in and out, and they're going out to Chick-fil-A or they're going out to this place or that place and bringing in other possible contaminants. So a little bit complex, but.
Oh, wow, that's a great thought. So they're able to, you're able to maintain that safety, that health and safety, because they've only been in your program. Mm-hmm. Okay, great. All right, what about you, Myra?
Okay, well, at drop-off time, I have my parents to sign in, and they have their own personal pen to sign in. And the distancing, I keep a social distance. When I'm conversating with my parents, I do a health check right there in front of the parents with the child, and I'm also asking about what's going on, how's the child doing, how's the family doing, how was the night, anything going on, any concerns. And then after the parent exits, then the child and I, we go and wash our hands, and we spray down and sanitize the sinks and the door handles, in the restrooms. So that's how we're able to maintain the social distancing.
Thank you both for sharing that. And those of you guys who are open in the chat, we have some great information, responses going on in the chat. Make sure you guys share with us how you're handling the social distancing, because we know that is a concern. So please share that in the chat. We have some participants on who want to support, so please let them know. Also, again, the resources here, go to DECAL's site. They update every day practically. So make sure you're going on and looking at the updates, because they're changing based on the CDC recommendations. So go there regularly. And then here's the CDC website that's specifically for childcare providers. So I want to talk about daily routines. You guys shared a little bit about your daily routine and what you're doing to change. We know in our profession, we probably wash our hands nearly as much as the medical workers, the healthcare workers, because you're doing it in between activities, and it's a lot. But during this time, we know you have added some extra steps to make sure that we are fighting against the pandemic. So I want to hear what you guys are doing. So from the time they come in the morning, just go through the added health and safety measures in addition to the traditional hand washing that we usually do. What added measures have you put in place since the pandemic? So Myra, you want to start this time?
Sure. With the sanitizing of the surfaces, that's done on a regular basis, actually daily. We clean the tables and sanitize them after every activity. We also implement, during our center time, we've minimized our centers to where one child is in each center, and our centers are at least 6 feet apart. So even when we're changing centers, there's only one child per center. And as regards to toys, all of our toys are washable. We're washing the toys on a regular basis, and things that are mouthed or dropped on the floor, we have what you call a yuck bucket. So it goes into the yuck bucket and it's returned to the area once we clean and sanitize the toys that are dropped. Let's see, in regards to mealtime, we stagnate our meal times now to where the children at the table. There's only 2 children sitting at the table, and one is on one end and the other is on the other end. So that's how we have managed that during mealtime. So that's all I can think of at this moment.
Myra, are your parents allowed to come in? How are you handling arrival and pickup?
No, they come into they don't come into the center. They're at the door at pickup, and I have the children. I usually know what time they're picking up, and I have everyone ready to go out the door.
Great.
So my sign-in sheet is right at the door. They have their own pen. They sign in and sign out. And then we also spray down the door handles.
Great, great. And someone asked that question in the chat, so we want to make sure we covered that. So want to share with us as well. Thank you, Myra. Want to share with us as well in the morning and your routine. And I know you have the 6 questions up here that I'll post for everyone. So Wande?
Yeah, so our parents drop off at the door. I think you might have some pictures, but they drop off at the door. Yep, those are my kiddos. So the lady that's on the left-hand side, that's Miss Ashley. She's been with us for many, many years. So when these regulations first came down, the first thing I thought was like, oh crap, like I got to get some equipment, but I don't want to do Walmart because they don't understand. Okay, I'm being recorded. I didn't want to go to Walmart. So I went online to get this stuff overnight. So we got these disposable lab coats, because if you're going to do these, if you follow the CDC recommendations, there's very clear outlines for how you have to do the temperature checks. They're very clear. You have to wear gloves, protective eyewear, they cover the sides, face, masks, all that stuff. So this is what we do every morning outside, document the temperature. The kids that are 3 and over, they come in the mask. The parents, it took a little bit longer for the parents to get on board with the parents wearing the mask. But in fact, I think starting like last week or the week before last, the parents actually, all of them started coming with masks themselves, because they always brought the kids with masks, but sometimes the parents, oh, I'm just gonna drop off, but they now actually, all of them come with masks and pick up with masks. Our Costco driver, our delivery driver, he wears a mask. So everybody in the business world, they're really supportive and doing everything that needs to be done. We use the contact-less thermometers. And the reason, you don't have to use a contact-less thermometers, but if you do use the ones that touch a child's face, you have to change those gloves every single time you give a temperature check. So for us, that's going to be a little bit cost prohibitive. It's just going to get too expensive. So that's why we use the contact-less thermometers. So that's some of the other safety measures all of our staff, they have, and I can't see myself, y'all, so I can't tell. But all of our staff, we have face masks, all of them. So that is required for all of us to wear here at the center, as well as the kids that are 3-year-olds and up. It took a little bit of time. I had to send a staff member home last week because she came without it, but she came right back with it. And it's just something out of habit. Like if you've never done it before, then it just takes time to get yourself trained. And it's because I want to protect myself as a business owner and make sure that I'm not putting my staff in an increased risk, right? I mean, we're all exposed to risk, walking outside of our house, picking up the mail, whatever, there's risk. But I don't want to have an increased risk by having any of my staff walking around without a mask. Another thing that we did, these are tablets. So at the end of every day, we disinfect our playground equipment with the, let's see, I think it's here. We disinfect our equipment with it's something like an electrostatic hydro pump. So two of these go inside here. We put it with water and we sanitize this whole entire building. That's on top of the regular sanitation. So we don't use regular Lysol because regular Lysol does not kill novel coronavirus. If you look on the back, it just says it kills coronavirus. We're dealing with COVID-19, which is a different strain. So you have to use the Lysol that is hospital grade. That's the one you have to use. And then starting day before yesterday, we just started this new one that says arrival 6 daily questions. We've even tweaked it a little bit. So whenever our staff come in, we now ask them, the director asks all of our staff these questions. Otherwise, how are we going to know? Like, what if they have what if they're coughing or having, and we don't know as an administrator, or what? How am I going to know if their husband or boyfriend or somebody has COVID unless I'm having that conversation with them? So I want to make sure, again, as a business owner, that I am doing that questionnaire with them and then having them sign the form that I've asked them that question. So these are just extra layers of protection for everybody around.
Thank you, Wande. And I do want to clarify for both Wande and Myra, they haven't had any cases since they've been open the entire time and haven't had any cases. So in case you were wondering that. We do have a question, and this is coming up later, but I know people want to know this now. Where are you ordering your PPE equipment from, Wande, and your thermometers, the contactless thermometers?
Okay, so this is tricky. So when this first happened, like when we first closed down, this is how I am. It's panic. Went straight to Amazon and did that. That's not what you can do now. We are getting on lower supplies, and so my plan B right now was to go into an emergency room and just kind of take somebody else's thermometer, because I'm figuring, like, y'all don't know how much money and premium I pay. I'm a healthy person, you know. I'm figuring I could take somebody's thermometer, but I did have somebody that reached out to me on Facebook last week and hooked me up with a thermometer. So it's very, very, very hard to come by, because when you go on Facebook, when you go online to order a thermometer, they'll tell you it's a 1-week delivery. As soon as you push purchase, they're going to email you back and say, oh, there's a delay in shipment. It's on a slow barge from overseas. It's going to take 6 weeks to get here. So yeah,
the government they're trying to maintain them as well. They're kind of keeping some of the orders from going out, from what I'm understanding, to maintain it for the healthcare workers. One day also, since so we know there was N95 mask, there's the 3-ply mask. You're using 3 layers, right? The 3-ply mask for the children and for staff?
So the parents have to bring their own. The parents are bringing their own. I do have an emergency supply of masks, but if anybody needs that, they're going to have to purchase it, because I believe if I give it away, then it becomes meaningless. They're too hard to come by for me just to give it out like that. I just can't. Maybe when it becomes more available, I can do that, but yeah.
Do you want to share any names of the mask and thermometer types, brand? I'm hearing people are asking about that.
You know, one of them was Eye Health. I'll have somebody get it in just a second.
And you can also type it in the chat too if you want, one day. Someone also asked about the sprayer on the playground.
Yeah, so I have to give so many kudos to this. The power of having a network and having other providers. Like if you're a provider and you're going through this by yourself, I seriously suggest that you find a network or find some other people in your area that you can connect with, because it's going to be to me, it's hard to do anything alone, even in this pandemic. So a good girlfriend of mine, she's a fellow board member with GCCA, gave me the secret. But anyway, they're called Brutabs, Brutabs. Unfortunately, again, they're on back order because they come from Ireland. So maybe about 6.5 weeks ago, these were like $50 a tub. Now they're going for like $200-300 a tub. But you can definitely look them up on the internet and just see who has them. But there's also different types, substitutes.
And we're going to go back to PPE in a little bit, guys. So when we talk about challenges. So we wanted to go into stakeholder engagement. We know maintaining two-way communication is one of the ways that we are able to make it through this time. So, it's important when we talk about stakeholders, it's your children, your parents, your staff, it's everyone who has a stake in your program, who's involved in your program. So one day, continue if you want to share about the community piece and how you're doing that. And of course, Myra, we want you to respond as well about stakeholder engagement and how you're keeping the communication going. Yeah,
so I always say, so if I have a child at my center that gets hurt, right? My belief is that parents, I always have kids that get hurt. Like I told Quality Care for Children this last night, like I'm a 3-star center, yeah, but I still have kids, issues, incidents all day, every day. So I'm not immune or exempt from any of that stuff. So I'm not up here telling you stuff that didn't happen in my school. When a child gets hurt, what is the reason that parents get upset? It's not necessarily that they're upset that their child has a bump on their head or a scratch. They get upset because it wasn't communicated well, or you didn't communicate at all. So we've been trying to be very intentional with communicating, over communicating, emailing, calling our families during this whole pandemic, you know, to check up on them, let them know what our plan is. When we were, you're going to talk about that later, but just communicate, and let them know why we're doing some things. I had parents that were upset that they couldn't come inside our building to drop their kids off. Ma'am, you know, I have my child is 6 months old and I need to, ma'am, I understand, but I need you to trust me, trust us, and trust the process. You can't come inside the building right now. Maybe we're not the right center for you at this time. And it's okay sometimes to let kids go or let families go, but I'm just not going to try to hold on to your tuition because you want to tell me how to run my center. That's just not going to happen.
So you have these family reservation forms. You want to talk about that communication before Myra starts?
Oh, okay. So you want me to talk about this, what's on the screen?
Mm-hmm.
Okay. So I'm trying to answer the chats at the same time. So the family reservation forms. So because my brain thinks very, it's just here a lot of times, I need order in my life. So when the governor just said that he was going to open the government back up this past Monday, the first thing that I thought about was, okay, I don't want to quote unquote mad rush of parents. I need to know exactly who's coming into my center. So that will help me plan for staffing, and that will also help me figure out some things. So this is the situation, y'all. I've had about 20 kids, 15, 20, 25, whatever kids here on average, about 20 kids on average here for the past 6 weeks. So if I have a group of 20 new kids that are ready to come in, I don't want that new group coming in to mix with my group that has been stable. I've seen no signs of illness. I know they're quote unquote healthy, right? I don't know where this group of 20 kids have been for the past 6 weeks that I haven't seen them. So I sent out this family reservation form so that I would know who was interested. I only allowed a certain amount of kids to come in this week, which is the first week we opened it up, at 10 slots, that's it. So I had to turn some families away and say, ma'am, you can't come in this week. So with that new group of children that are coming in, I have them separated from the quote unquote healthy kids. So for 2 weeks, it's almost like I have them quarantined. For 2 weeks with these other kids, I'm kind of doing a monitoring. But if you've been closed for 2 weeks, then all of your kids are going to be under monitoring and surveillance. So it really wouldn't matter.
Okay. It looks like one day you use Google Forms, which is free for anyone who is wondering. Am I correct? This is a Google form?
Yes, it is.
Okay, so you guys can do that. Myra, you want to share how you've been communicating with your parents, your stakeholders, and how this has supported to keep the panic down in your program?
Okay. Yes, Bisa, I communicate verbally with my parents because, again, my ratio is 6-to-1. And so I'm dealing with a very small group of parents, 3 parents at the most. So I am able to talk to them personally. And if there's something that I forget to mention, then I can text them. But we have we really have a good method of communication. And again, I'm at an advantage because the group that I have, I've had them since they were babies. So I know my children, and I can tell when someone's not feeling well. You know, I'm looking at their eyes. I can monitor the behavior. So I'm usually like really on it when I notice a difference of behavior. And so, and when I do notice that, you know, they immediately will come and pick them up, you know, if they're not feeling well. I haven't had that since COVID, but basically that's just been my overall policy, is that, you know, I talk to them on a regular basis, I inquire, and then I also I give suggestions in terms of how to maintain your health holistically by eating and resting and eating good food, and, you know, eating a lot of food, you know, enriched in vitamin C, and drinking water and resting. So that's how I manage that.
Myra, will you also share with us the makeup of your age groups? And then I know you have some siblings. Tell them about the 6 children you have.
Right. The age group, I have 2 toddlers and 2 families with 2 toddlers. Okay, 1 toddler, which is an only child, and then the other ones are siblings. So I have 3 from one family: a toddler, a preschooler, and a school ager. And then the other one is let's see, 2 toddlers, no, a preschooler and a school ager.
Okay.
So,
Thank
and
you,
I've had
Myra.
them since they were infants, all of them.
So we're going to talk about what you guys are doing with the children, what they're learning during this time. And also after that, we'll get to the challenges, which we know can be PPE, cost modeling, and so that's what's next. So what are the children doing in your program? Those of you guys who are also open, if you type that in the chat, Wande's been answering some of the questions that you guys are asking her in the chat as well in terms of products that she's using. So what are the children doing in your program, Wande?
Yeah, so this is harvest of the month is strawberries. So we're learning about strawberries. Anybody that knows anything about Little Ones Learning Center, we are huge farm to ECE advocates. We live, breathe, and die farm to ECE, health and wellness. So the kids are still doing the same things, just with fewer kids. So they're getting lots and lots of language and literacy development. And our motto and what we really strongly believe in is we are going to do for one kid what we would do for many kids. We're not going to say, oh, well, there's just 2 kids in the classroom today, we're just going to do nothing. No, we're not going to do nothing. I've also, so that's our that's Miss Lulu. She is our garden educator. So you can see her doing a Zoom cooking class. So she taught the kids how to make ranch dressing that aren't here. So we're still doing the exact same things. It's also giving me time. You can see that picture in the top to put my eyes on my center better. So I saw lots of safety hazards and things that I was not pleased with throughout my own center. I mean, boards around the center, and I saw some paper falling down in some classrooms and border paper here. So it's also given us a lot of time to really fine tune some of our own practices.
Thank you, Wande. All right, Myra, what about you? What are your children learning and doing right now? I can't hear you, Myra.
Okay,
Oh, yeah.
okay, we had a technical difficulty.
Okay.
We're doing the same. We have the same routine, Bisa, and we are a strong advocate of the Farm to ECE program, and we also incorporate health and power initiatives in our program. So right now we're gardening. We've been growing our vegetables, and we've been planting in the garden. We have a play garden that I'm very, very excited about. We just had a mud table built and placed it in the garden areas, and we're outdoors at least an hour and a half every day. So that has kind of helped to relieve the stress of what's going on, to stay consistent with our regular routine.
Great, thank you so much, both of you. So the big question, we know a lot of you guys want to know about the challenges for a variety of reasons. So you can use the information yourself, maybe you can provide some support. So in terms of funding, supplies, PPE, what have been the challenges? And those of you guys who are providers, please type that in the chat. So Wande, you want to start?
Yeah, I mean, I think the same challenges that everybody else is facing. I mean, I know people were saying, oh, we want the governor to lift the group sizes from 10 to the regular size, and that's all well. I'm not here to make any kind of political statements about that, but my thing is always safety. And for us, even if that was lifted, I'm not sure that I would want as many additional kids immediately, unless I knew that I could guarantee their safety and the safety of my staff. So I need to make sure that I can have enough personal protective equipment for my staff. There was a question in the chat about how do I manage the breaks. I want you to understand there's not that many kids here. So 8-hour shifts is very different from a typical 8-hour shift when it's constant, fully enrolled center. So when they're down for nap, those teachers they're on quality care for children, taking training classes, they're eating. So they're having 2 hours and it's paid. So I'm not asking them to clock out and just stay in the classroom. It's paid. They just are not leaving my property to protect that stuff from coming in.
Great, thank you, Wande. So And I'll let Myra respond, and then I'll ask a follow-up question. Myra, you want to share your challenges and your how you're handling costs, the different costs? Mm-hmm.
I think my challenges have been pretty minimum, Bisa, in terms of the cost and the availability of like sanitizing supplies and cleaning supplies. I found that you know, it was kind of inconvenient to have to go to a store and the shelves were empty, you know, to purchase things. And I did have some things that I had a quantity of, so that was relieving, but I still want to make sure that I had enough of whatever I had. So, you know, in regard, and then with the stores closing early, that was like a real big inconvenience, because, you know, I'm not able to shop until after 6 o'clock, sometimes 7 o'clock.
Mm-hmm.
And then with the stores closing early, that was like a big, I'm like, oh, wow. So I just sort of stock up as I can, you know, on the supplies that I need. And if, you know, I just buy extra and make sure that I have what I need on hand.
Thank you. And Wande is answering some questions in the chat as well. So what I'm hearing from both of you guys, because you have fewer children, your needs are not as, well, you're not having to buy as much, maybe food and certain cleaning supplies. However, there are some supplies that are difficult to find. So if you could give everyone one big quick piece of information of the best way that you're shopping and getting these supplies. I hear Myra say she's going after 6 p.m. every day. How are you getting your food? Where are you getting it from? And when are you getting it? And
well, I shop at the local Walmart. And so what I started doing is I look at my menu, and I really buy enough for a month. Okay. So that I don't have to worry about it, about what I can, you know, what I can put away or put in the freezer. I'll do that. And then my you know, my everyday products or whatnot, we'll buy a week's worth, and then we'll go back to the store the next week to restock.
Okay, so Walmart. Okay.
Yeah, Walmart.
Okay, thank you. And then in terms of, what about you, Wande? Where are you shopping for your program?
I told you I'll be at the emergency room if I ever get all the way out. But I don't want to, just anywhere. They had Quality Care for Children posted the other day that one of the distributors, I think Sam's, had a trunk show that they were offering some stuff. But I think it's really hard. People are running out. I did hear somebody contacted me and said that Sam's did have some PPE in stock, but I mean, by the time you get there, it's gone. So like I said, like this stuff right here, this is like gold. The stuff that it's so funny because we have like parent volunteers. And so one of the things that we used to ask our volunteers, parents to volunteer, I said, we want hand sanitizer. So we were lucky and had a lot of that, but it started running out, but yeah.
And it looks like you were on social media one day asking for, and you were able to get some supplies because of your post, correct?
Yeah. I was. People, they don't want me to mess my perfect record. I have 0 records, so I would hate to go to jail and have for stealing a thermometer. It was getting to that. I mean, I was gonna clip one. I was like,
But that's powerful, though. I think people need to know they can use their social media to ask for their needs. So what's on your wish list? We have some people in our meeting today who are here to find out what supports people need, because they're on foundations, they're in nonprofit organizations, and they want to know what's the best way, if they can pull together the money or as they pull together funding, what's on your wish list in terms of being able to stay open, those of you guys who are not open, what do you need to open? Put that in the chat. What are your concrete needs? Those of us who are leaders, who are in all these meetings every week trying to figure out how to support you, what needs to be on our list to help you to open and or stay open? So Wande, you want to start?
Our needs, my most immediate needs are to continue to have that support and advocacy around who we are and what our industry is, because this will end, right? Like this pandemic, it will end. And, I want to make sure that ECE is on the right side of this and that our image is protected, not just now as essential workers, but afterwards, after this is over, will we still have that that prominence, or are we going to go back to the bottom of the list as just babysitters? So it's not really a concrete need, but I need that funding to continue to be invested so that we can have, whether or not it's premium pay, whether or not it's whatever, because it shouldn't be a situation where you have anybody that would, it should not be a situation where things are structured to the point where it's better off financially to be on unemployment than it is to be working. So those are some things. I don't want to get into a back and forth about that, but I want to make sure that when we get back on the right side of things, and all these people that are on this call are opening up their centers, I want to make sure that their workers are ready to go back to work, because it's going to be a problem if they've been collecting unemployment and don't want to come back to work.
Thank you, Wande. And before you answer, Myra, I want to encourage everyone, every provider who's on the call, please go to the 3 dots where it says more, and I want you to click on chat and type in there what are your needs, because the people who are here to support you, that's what they're here for. We want to know, what do you need? We want to buy the right thing to support your needs. So Myra, what about you?
I'm gonna support what Wande says, the continued support and acknowledgement of the work that we do. That's very, very important. I was happy to hear Governor Kemp, acknowledge the child care providers as an essential worker, and also the continued resources. I mean, I've gotten so many emails and opportunities to participate in dialogues with my colleagues, and that has just been awesome. Because this is work. We work long hours, and oftentimes we are the ones that are unnoticed. So just to stay connected in the industry and be acknowledged and supported, to continue the funding coming forward for family child care and child care centers, and just to see family child care included at the table in the conversation is greatly needed and appreciated.
Thank you, Myra. I have been in some meetings where the thought is that diapers and wipes are highly needed. You want to do, is that something you need more of? Are you good on those? It's primarily the PPE that's the issue.
I'm good.
Okay, on diapers and wipes. Wande?
Yeah, I'm good.
Yeah, I see Noni posted also. Yeah, just the alcohol wipes. That's what maybe post that on that social media, that they weren't offering. Just alcohol wipes.
Okay.
But no diaper wipes.
Okay, got it. All right. So moving beyond, we want to share with you guys how they've been able to stay positive, move beyond, keep those parents encouraged. So Wande, you can start here since this is your information.
Yeah, so I talked about this a little bit earlier. We limit how many kids that we limit how many children that we accept per week. So that's part of our re-enrollment strategy, to gradually reintroduce them. And so we also do require those new kids that are coming in that they need to come consecutively. So it's not, I'm going to come on Monday and I'll see you guys again on Thursday. No, I need to know that you're not having a fever on those in-between days. So I'm going to need you to be here every single day. So these are conversations that we have prior to re-enrollment to make sure they understand that if they have consecutive days missed, then they're going to have to start all over again as part of that re-enrollment strategy, so we can monitor them. New groups of staff. Yeah, so we don't let the cooks go inside the classrooms. Like, we really limit who is actually going inside the classrooms, because if an outbreak does happen, or not an outbreak, if we do have COVID exposure in a classroom, we want to be able to isolate it to just those groups, that one teacher and her 4 or 5 students, rather than say, okay, the cook was in there, I was in there, so-and-so was in there, and it's just, the web grows longer. I mean, we would probably take other measures to mitigate, whether or not it's closing down for 2 days or 10 days or longer, but it just really limits the amount of exposure. Yeah, so moving beyond, this has been a great time to, I don't know how many interviews I've done on Zoom with new staff. So this has been a great time. And just mentally preparing myself. What should I do to prepare myself financially? Am I looking at a 30% re-enrollment from now until December, 40%, 50%? What am I looking at?
And what about your rate? Pam Tatum from QCC asked about rates. Are you thinking about adjusting your rates? And Myra, you're answering next too about the moving beyond. For a center, are you guys adjusting rates? Okay.
Oh, okay, I see it. No,
Mhm.
I can't right now. My rates are still what they are. Actually, I was already planning a price increase, but we delayed it now until June, just because, again, I think people have to look at their communities. Maybe some communities can do that. My community, I don't believe that we can absorb that cost right now when so many are laid off, not working. You know, they're 1099s, they're beauticians, they're in a different place than maybe some other industries.
Okay, and time has flown. Oh my gosh, we have 10 minutes. So Myra, please share how you're moving beyond. I know you have some help who works with you some days because you do training and take training and everything, but share how you're trying to move forward.
The way that I'm trying to move forward, Bisa, is just to stay consistent with what we're doing with our practices and procedures. I think that I will update my wellness policy and be more strict in regards to health and wellness with my families, and also educate my families, having more conversations about, you know, the wellness of their children overall, you know, diet, exercise, drinking of water, and just staying healthy and encouraging that with them as well as with myself. So in regards to tuition increase, I'm good where I'm at right now. I did drop 2 families, so I will be looking to recruit that as soon as things kind of calm down a little bit. I'm in it to win it, so whatever strategies need to be put in place to achieve full enrollment, you know, I will do that as well. And I'm looking forward to, after this pandemic sort of kind of takes a break, you know, to get back into the routine of doing some other activities in our program.
Thank you, Myra. And I love how you have adjusted your policy of how you're accepting families and how you're maintaining families on your roster based on needs. So we are encouraging everyone to be bold, be brave, be courageous, because we know this is difficult. Should you decide to open, at least you have some resources today. We know that community matters, so it's very important to stay connected. The 90+ people who are on with us today, someone connected you or you were already directly connected to us, but there are other ways that you can stay connected. These are just a few organizations that you may have heard. Wande mentioned DCCA. You guys want to share quickly what organizations you're connected with that are helping you to make it through this pandemic?
Yeah. Oh, go ahead, Myra. Go ahead.
I'm connected with PFC, CCAGA, NAFCC. There are a couple of local provider. One is called Impact Educators, and we are connected on a regular basis, checking in and make sure that we are well and what type of support we need as family child care providers. And just my local and general community, being aware of what's going on with my, you know, in the East Point area with the city of East Point, and just staying in touch with everybody.
Great, thank you. Those are great organizations. And we know this is not all of them. These are just a few that they mentioned. United Way, we know some people are not here in Georgia. If you're in Georgia, in Atlanta area, you have United Way of Greater Atlanta, and we thank them for their support. But based on where you live, check out your local United Way. Wande, tell us about how you're staying connected.
Yeah, I encourage everybody, if you are a business owner or director, to reach out to, everybody should be a member of the BCDI if you serve a population, any population of brown or Black children. So even if you have one Black child, you should be a member of the Black Child Development Institute to understand the needs of the organization. Also, the Georgia Child Care Association, you cannot be a business owner and not be part of the Georgia Child Care Association. We advocate for businesses and business owners. So when you see increases into the funding for pre-K, a lot of that comes from our advocacy leg at GCCA. When you see the federal background check, that's GCCA that's lobbying and meeting with these senators and congressmen and all these other people to help it make so that our businesses are protected. So it is a business portion to protect what we do.
Thank you. And Quality Care for Children, we know that they are extremely important. These are primarily membership organizations, but qualitycarefordchildren.org, make sure you guys are connected with your local resource or referral agency, basically where you are, and look for the Pam Runkle, if you're still on, if you want to type the whatever the current JACRA link is. I know it may not exist as the old JACRA, but to make sure they can find their local resource or referral agency, whoever wants to share that link, so that wherever you are, you can figure out who to connect with in your area. All right, so we wanted to share this. This is a webinar that Child Care Aware did. They're also a large national nonprofit organization and membership organization. They had a recent webinar a couple of weeks ago on child care during COVID-19, guidance and implementation from experts, and they have some useful links on their site. So if you want to go to that link there that's on the screen, take a picture and check out that webinar as a review as well, so you can get some more guidance. And we are, as we thought, we did really